The ability to vote changes things and advances legislation so that we can have programs like Project Lifesaver and special programs for those with special needs. So, our next two presenters, first is Jennifer Cicia, who comes to us from right down the street at UCF at the Center for Autism. She's been with them since 2011. And she's going to be joined by David Silver. David is a former member of the House of Representatives here in Florida, and he's currently running for the Florida State Senate. So please put your hands together for a warm welcome to David and Jennifer.
Thank you so much for coming out. I want to thank Gene Saunders for having Jennifer and myself here today, this morning. I don't know if you remember, I was here last year as an attendee. I was still in House of Representatives. And Jennifer, I do want to do a quick intro, but I just want to do a little background. I wasn't supposed to be up on stage last year, and last second I was pulled up. Like, oh, hey, how are you? Nice to meet you. This time I'm a better prepared, so apologize for last year. Jennifer Cicia with CARD. Anybody here familiar with CARD? Yes? No? Maybe so? Okay, too. All right, Jennifer, I want to let you do a quick introduction of yourself and about CARD and what you do at UCF.
All right, so this year it's my turn to find out I was going to be up here. So bear with me, but I'm going to do my best. So I am Jennifer Cicia. I am, like you said, at the UCF Center for Autism and Related Disabilities. We are really lucky here in Florida. Any of you that are in Florida may be aware that we have a state-funded program for people with autism of any age, from diagnosis to death. So the youngest person on my caseload ever is probably about 18 months, and currently the oldest person is about 65, I want to say. So we cover all ages. And those services are completely free of cost to families, professionals, anybody who's needing some help to either support or even the individual with autism themselves. So that's me. I've been doing that since 2011. I've been working with people with autism since 2003. And my big focus right now at CARD is wandering and drowning prevention. So that's kind of why I'm here today. That's me.
Thank you, Jennifer. You want to tell the audience a little bit about yourself, where you're from?
Sure. So I'm originally from New Jersey. I was there until I was 18. Decided to move a little bit down to the East Coast. Went to college in Virginia. And then I decided I wasn't far enough down the East Coast, so I came down here to Florida. And I've been here ever since, about 18 years. So I've done about a little less than half my life in New Jersey, a little less than half my life here, and then a stint in Virginia. So that's me. And actually, maybe I should tell you guys a little bit more about CARD, since I think only two of you said that you knew what CARD was. So like I said, it's completely state funded. And what we do is we provide direct services to people with autism. We don't do the therapy. There's like 15 of me, and we currently have over 20,000 people registered with us. So if I was going to your home and doing ABA therapy, you'd get like 3 minutes a week, if even. So we don't do that, but we help them find people that can do therapy, and we help them find resources. We help troubleshoot. I can go out and do home visits. One of the things I'll get to talk about maybe a little later is we can do safety plans for people who have children that wander envelope. We can go to their home, help them look at their house, make sure it's set up for safety. And we do technical assistance for anybody that works with somebody with autism. We do public awareness, which is how I got here today. And we do training for parents, professionals, and anybody else that wants it.
Thank you, Jennifer. Appreciate that. As mentioned before, I'm David Silver, former House member. I served in House of Representatives here in Florida from 2016 until 2024. And a little bit about myself. I'm a born and raised Floridian. Born in Miami, raised, and went to the University of Florida. Proud Gator. Any Gators in the audience? All right, go Gators. I do see one University of Georgia shirt in the audience. We're not picking on much. And also Hurricane, got my love green NBA at University of Miami. I became familiar with Project Lifesaver International when I was in the legislature through Candy Spitz, who's actually here in the front row. As you may know, Candy has twin sons that are autistic, and I've been very passionate about children with autism going back to when I was a child. One of my sister's best friends, his her brother was my age, and he was nonverbal. And at a very young age, I tried to have a relationship with him. And they ended up moving away, but it was a lasting mark on me that I wanted to be a part of the autism community and do whatever I could to improve it for my own community. And I was elected to the House of Representatives. I came last year. I spoke about a story of a gentleman by the name of Derek Mazer, who was a police officer with the Boca Raton Police Department, who went through Project Lifesaver's training, and he came on a domestic violence call, and there was a mother who was being held by the adult son with like a kitchen knife, and he had been through the training. He understood some of the key indicators, and he was able to de-escalate the situation. Nobody was hurt, nobody was arrested, and that's got to be about 15 years ago. I believe I told you about this 15 years ago. And wow, okay, this really does help. It saves people's lives. So I'm here now as a former member running for the state senate, and I want to talk to you about a bill that passed this year. It was a spectrum alert bill, which I think is incredible for the state of Florida, but also legislation that I would like to file when I'm in the Senate that unfortunately did not move this year. Just because you've got one spectrum alert bill, there's a lot more that can be done. And I think Jennifer can agree with me.
Oh, yeah.
So we're here to talk about House Bill 711 from the past legislative session here in Florida. It was sponsored by Representative Barrero in the House and Senator Brian Avila in the Senate. And that created a whole new spectrum alert for the state of Florida. Now what's interesting, in Florida, our legislature seems to be a reactive legislature. Whereas I was talking with Jennifer before we came up here, she's from Seminole County. Well, that's where you currently reside.
Yes.
They've had spectrum alerts for the better part of almost a year and a half. And I thought that was great that Seminole County has been this proactive county. So you have a county in the state of Florida that's already started this type of program, well before the state has actually instituted the program. This program, through House Bill 711, the spectrum alert bill, wasn't effective until July 1st this year. So going back 2024, maybe even 2023, you got the alert?
I for sure got an alert. It was summer of 2024 when a child went missing, maybe about 5 or 6 miles from my home. I got an alert.
And the alert that you received wasn't just a missing child. What was specifically in that?
It said in capital letters, missing child with autism, and then it said, please check water. And then it had a little link. When you clicked on the link, that brought up a picture of the child. I believe that parent had been super proactive and had a picture of what they were wearing that day. And so it pictured the child in the clothes he was wearing, and it gave some details about height, hair color, eye color, skin color, that identifying information.
And can you there was a key indicator, key word that you said that water, look for bodies of water. Can we just discuss that for a moment here? Why? Because I'm not sure everybody here is aware of why we need to be so aware of bodies of water.
Yeah, so in general, many children with autism are drawn to water. People always ask me why are kids with autism drawn to water? And there's no this is why, this is the reason. But what we think is the reason is there's a lot of good sensory appealing aspects to water. It's sparkly, it's pretty, it looks, if you go to SeaWorld and you look at the whale tanks, you're like, I want to get in there. That looks really, really nice and cooling. And it's an enjoyable experience for a lot of people. But then kids with autism don't always have that safety awareness and that impulse control to say, yeah, that looks really cool, but I'm not going to jump in there because that's not safe. My mom's not here, my dad's not here, I don't have permission. I can't swim. Sometimes they don't even realize I can't swim, so I shouldn't get in that water. So unfortunately, about 50% of kids with autism have a tendency to wander or elope. And most of the time when we talk to those parents, they say that their child seeks water out when they do that. So that's what's going on.
And then, thank you for explaining that. And that is the reason why HB 711 is so important, the spectrum alert. Like I mentioned before, there's the silver alerts you see when you're driving down the highway. There's silver alerts, there's purple alerts, now there's spectrum alerts. And I like to just go over briefly the bill language, if that's okay with all of you here today. It requires the Department of Law Enforcement. Now, if you're the Florida Department of Law Enforcement highway safety of motor vehicles and the Department of Lottery and local law enforcement agencies to establish and implement the special alert to enhance safety and well-being of children in the state. Now, the Department of Law Enforcement, in cooperation with all those agencies that I just mentioned, they have developed the training program, the alert system, that is compatible with the current alert system. So they're not creating a whole new alert system. They're just going to be able to have to be compatible with the current system in place. So Jennifer, you explained to me the reason why this bill is so important, and now I'm trying to explain who's going to develop it, where it's going to be set out from, and now I guess these alerts are going to be statewide, not just going to be in Seminole County, not Seminole County.
Yes.
So,
Well, that's where I live. I'm sure there are other counties implementing it as well, but Seminole has been implementing it for some time.
so I'm from Palm Beach County, and I've never seen the spectrum alert notification. So now there's going to be a requirement. Now they may just be geo-targeted if there's I'm going to assume that. If there's a child that's missing in Volusia County, it may just be Volusia County. But this was not in place when you got that alert.
No. But I know, so one of my coworkers, Dr. Kim Spence, is heavily involved with training law enforcement, developing different protocols. She's very, very involved with that daily. And she was saying that they have been talking about this for quite some time and implementing it for quite some time. And the recommendation at that point, she said, was about 3 to 8 miles, that everybody within a 3 to 8 mile radius would get a text.
Also, they've been talking about this for a while.
They have been talking about it. It was not state law yet. It was not across the state needed to be compliant, but it's something that's been in discussions for a while.
Interesting. There's another bill I want to get to in a few minutes on a training protocol. But that's interesting that FDLE it's already been part of their, something that they knew there was a need for it.
On the radar, for sure.
And I'm sure this is going back years. This is not new.
Yeah.
And I've been in contact with FDLE for years, being in the legislature from 2016 to 2024. Nobody's ever brought that up to me. It's not that.
No.
But thank you for sharing that. Before we go on, I know this is a fireside chat, but are there any questions in the audience? Does anybody have any questions? Ideas, recommendations? Oh, no.
Is there a way, you said you're not sure if I'm sorry. I think you said you're not quite sure if the spectrum alert will be local, regional, or statewide. It probably should be statewide for each event because somebody may be traveling to that area and not otherwise get the alert because they're based somewhere else. And people can wander for many, many miles over county lines. So for things like that and other things, and you may be prepared to already get into this, but how can people voice their concerns or feedback or suggestions? Who can they go to say, hey, it would be really great if you could integrate this functionality into this alert? Is there a way to do that?
Yeah, go for it.
Thank you for the question. I'm actually looking at the language right now, HB so that was passed on such law. It's not geo-targeted, it's the entire state.
Perfect.
It's something that limits it. And who should you go to in the future if you have recommendations or ideas?
Mm-hmm.
Maybe you should do local state representative or state senator. That's what I would do.
Okay.
That's now that I'm not in the state house anymore. It's in the past 9 months or 10 months. I've been going to my local state representative. Oh, by the way, here's an idea. Whether or not to take it,
Mm-hmm.
I'm not sure.
Okay, thank you.
Anybody else?
I'm also from Palm Beach County, and I have not seen those alerts. Now, I'm unfamiliar with the process. How long would that take for something like that to reach a county of that size, Palm Beach County, to get that ball rolling, to get this system in place?
Well, sorry.
No, go for it.
It has to be by January 1st, 2026. It's part of it.
Gotcha. Okay. Thank you.
So I have very limited understanding of how this works, but my husband works for City of Orlando government, and I've talked with him a bit about it, and he was saying, these emergency alert systems are already in place through Amber Alerts, Florida hurricane weather alerts. So it's just a matter of now using it in this different way. But it should be, I think, fairly quick to get it up and running.
Actually, well, it's July 1st, not of 2026. That's when they have to start putting it all together. Just read that. Any other questions? I saw a hand up in the back. You good? Okay. Anybody else? Okay. So last year, I want to talk about last year for a moment. Paula Stark, Representative Paula Stark is here in Orlando. She was actually going to be here to present to talk about this bill because she actually worked on this bill this past legislative session. But she was unfortunately she had unable to make it. She and I spoke before she presented last year on a bill that was a great piece of legislation. It required certain levels of training for law enforcement agencies to address individuals with ASD. It was a great bill, great policy, but it died. And it died because of, unfortunately, I think it was a personal issue between her and the chair of the certain committee. That's life. And I told her, you can just file it next year. That individual was turned out, not going to be there next year. And unfortunately, she wasn't even going to pass this year. She filed it again. It's actually House Bill 1273. And that is, it's establishing an employment training component related to individuals with ASD. There's nothing like that currently in statute. And after getting it to the Senate, and knock on wood, hopefully out in the Senate in 2027, I would like to make that one of my primary legislation bills as soon as I'm elected. I think it's extremely important to provide that type of training statewide. And as I mentioned before, the story with Derek Mazer not overturned. That individual was a domestic violence call, the mother being held by the son, killed someone with a kitchen knife. And clearly it works because nobody was hurt. There was no arrest. Everything was de-escalated because of the training that came through. Now, not every agency, like as you know, in Palm Beach, in Florida, has that level of training. I would like to, hopefully, we'll have a standard of training throughout the state.
Well, and we're really fortunate, again, in Florida, because the card centers are able to provide that training at no cost to any law enforcement entity that wants it. I know our center at UCF Card, I can speak to specifically, we offer training every single week. We're in different sheriff's office, police departments doing training. I know at one point Seminole County had done their entire force. Another point, Apopka, city of Apopka had done their entire force. So we're there. We do it for free. We do CIT training. We give monthly refresher courses in CIT to many of our counties locally. So it makes it really easy to implement that type of law because we could just slide right in there and give the training that we're already doing.
Now, do you have the reach, forgive me, I probably should know this, but do you have the reach from Pensacola all the way to Key West to be able to slide in and just provide that?
CARD does, yes. So CARD is based regionally. There's 7 centers in the state. We're at UCF. We cover Orange, Seminole, Lake, Sumter, Osceola, Brevard, Volusia. Those are our 7 counties. But every single county in the state of Florida is covered by a CARD center that would be able to send and provide that training.
Okay, so there's a little presence.
Mm-hmm. Yep. Key West is a little harder to get to because I think Miami covers that. So, but doesn't mean they can. We can do it anywhere in the state of Florida.
That's good to know. I'm learning more about CARD anyway. Do you want to go over some of the flyers that have risk
Sure.
protection
Yeah.
on the checklist?
Yeah, so we were talking about earlier, very sadly, Florida leads the country in pediatric drowning deaths. So we had 105 pediatric drowning deaths last year in the state of Florida, and 28 of them were children with autism. So sometimes I'll say that, and people will say to me, oh, okay, I thought that like there were a lot of people with autism drowning, and it sounds like when you say there's 105 and only 28 of them have autism, that sounds like it's actually a low number. But when you consider that autistic people make up about 3% of the population, but made up about 33% of the drownings, it's very disproportionate. So it is actually a very big problem. This year, just in case anyone's wondering, I got the updated numbers from DCF this morning. We're at 88 drowning deaths in Florida this year, and 19 of them were autistic children. Pediatric drowning deaths, and 19 of them were autistic children, so that's about 21.5%. So percentage is a little lower, but still a big problem. And last year was the record setter for Florida, so we're on track, unfortunately, to be the record nobody wants to be. So at CARD, we are doing everything we can to help limit this from happening. We have put together, the layers of protection program. And basically the way we look at this is no one thing is going to save children from wandering below being drowned. You have to take multiple steps. So we talk about first step is safety proofing the home. We want to make sure your home is safe from these types of risks. Once that home is safe, when the child's supposed to be home, we want to keep them in the home. So that's like, parents are sleeping, parents are cooking, they're not being supervised, they should be inside the home. So then we're going to put locks, childproof locks on the doors, which varies at age. Sometimes people say, well, what lock should I get? And that there is no answer to what lock should I get. Depends on what your kid's skill level is, what their height is, what their age is. Then we talk about alarms. Important that children have alarms that will alert the family that they've gone missing. We don't want beep beep alarms because beep beep happens, the parent's sleeping, they have no idea their child got out of the house. Continuous alarm going off until the door is closed. We talk about fencing all water on the property, and if possible, fencing your property. It's just another barrier that prevents them from getting off the property. Then the next step is you all. We say contact 911 immediately. Do not hesitate. Do not look for 15 minutes and then call law enforcement, because 15 minutes it could be too late. So I know I was talking to our local Seminole County Sheriff and Sheriff's Office, and they had said to me, I would much rather a parent call and say, oh wait, never mind, found them, than not call and we find out and it's too late. So we always say call right away. And then we talk about a neighborhood communication plan. That's where it's really cool that this bill exists now, because we talk to people about get with your trusted neighbors, get with your HOA, see if locally an alert can be sent out. Maybe the HOA can make a search committee, that if something happens, that search committee is ready to mobilize and go out and search water in the area. So that's kind of our next step down. I'm sorry, I lost my train of thought. Tracking devices. So then after that, we talk about tracking devices. Project Lifesaver, of course, in the areas that it's offered. Unfortunately, in Central Florida, only 4 of our 7 counties do offer Project Lifesaver. And that's Orange, Brevard, Volusia now is the newest, and Osceola County. And then we talk about other options in the counties that that's not available. We talk about high-quality swimming lessons. And then that's the last one. Before that, we talk about a plan. So all of these things are to prevent children from getting to water, right? Locks, alarms, fences, we've got law enforcement out searching. We hope they don't get to water, but if they do, we want to teach the child not to get to water without permission. So we put together some training materials for kids and families to use with them, and we've been using a bracelet that every time a child goes in water, the parent puts the bracelet on them. You can't go in water without your bracelet. Children with autism are very routine and goal-based, so we're hoping they get to that water. They don't have their bracelet on, they're like, oh man, I can't get in that water, I don't have my bracelet. And then not the last step to take, but the last step of resistance with these swimming lessons. We want our kids to have high-quality swimming lessons, make sure that if they get into that water, they can keep themselves afloat until help gets there. So that was a lot, but that's our layers of protection.
I thank you for that. I think what's interesting to me is teach water is closed. That's interesting. So is that the same thing with the wristband?
Yeah.
I don't have a wristband, or I can't go in that water anymore, it's not open yet.
Yeah, just we look for like basic phrasing. Water's closed, can't go in that water. A lot of times negatives are confusing to kids with autism. So like, don't run is not as effective as walk, because if they have difficulty processing multiple words, we don't want them to process run. We want them to process walk. So and then the negative can be confusing. So water is closed is just a simple way to put that. Water's closed, can't go in.
Have you found that that's been effective?
It's something that is fairly new that we're using with families. We rolled this out in about June. And it's really hard when we talk about is it effective. Same thing with like Project Lifesaver. We can't prove that that child would have drowned if they weren't wearing their tracking device or if they didn't have the bracelet program. What I can tell you is nobody that we've done this with has, thank goodness. Yes, I think it's effective. Yeah.
Okay. Sounds like it is. What is this here, this water time?
So this is a training material that we put together. It's a social story. If any of you are familiar with social stories, it's just a story that explains the situation and gives steps to be taken in that situation. So this is just a generic one that we made. It explains about what we should do, when we should get in water. It pairs with the band, so it's so parents can teach their kids about not going into water without the band. We actually personalize these. These are generic pictures. I should have brought the one. I have one with my son featured in it where it's got his pictures and he's wearing his little water time band. But yeah, if a parent comes to us and they want to participate in this, they want to work with us, we'll make one of these for them. And it just, very simple language teaches kids that they don't go in water without a parent.
So is that like you're in North Carolina area here, the car location Miami, your parents, you can just go into the car location and say, can you make that for me, for my family? Oh,
Yes.
it's a great
I
resource.
mean, I don't want to speak for Miami, but certainly at UCF, yeah, 100%. And I don't see a reason why that wouldn't be able to happen at any other card center, so.
It's a great resource that people probably still aren't aware of.
Well, I hope they're aware. We're trying.
Yeah.
We have over 20,000 people registered with us in Central Florida, so.
How many people are registered throughout the state?
We just got the updated numbers. I want to say it was 68,000.
So almost over a quarter, or just in Atlanta.
Correct, yeah, we have the highest numbers in the state at the UCF Center.
Wow.
Yeah.
And then the wandering traffic safety plan.
Oh,
is that-
so this just basically pairs with the one we talked about. It's, I'm sorry, it's where we can kind of fill in. So I'll go to someone's home with this and I'll say, okay, let's talk about any potential water hazards in your home. You know, let's look at, does your child go in the bathroom and try to turn on the bathtub water? Because children can drown in ditch water. We've heard of children drowning in toilets before. So does your child do that? If they do, what kind of protection? You need to put a little lock, child safety lock on the toilet so that they can't get into it until you're with them. Obviously, we want children to be in the bathroom. But we don't want them to do it unsupervised if it's not safe. So then we look at the doors. What kind of locks do you need? And we kind of go down and create a safety plan for the families.
So this is all great here in Florida. And I know a lot of the individuals in our audience are not from the state of Florida. They're coming from all over the country.
I'm sorry.
You will have a relationship, this part of a relationship with those organizations in other states. And share what's working, what doesn't work, and do they share with you?
So, unfortunately for other places, fortunately for Florida, we're state funded programs. So like CARD is not a nationwide thing. That's just our legislature decided that this was important. Parents actually went in the 1980s to the Florida legislature and said, there's this autism thing, we're not sure what to do, so we need help. And they put together a grassroots movement and brought it to the legislature and it's approved and we've been here since the 90s, I believe. So do we have relationships with other cards? No, because they don't actually exist in other states. But we do work closely with Autism Society of Florida, we work with Autism Speaks, and there are certainly autism societies and autism speaks in every state. I would be happy to talk to any of them about any of this. We would, yes. Do we necessarily? No, not necessarily. We would.
So there's not one other organization throughout the country that's in the same level as CARD.
So we are not aware of any organization in any other state that does what CARD does. That doesn't mean that nobody exists, but there's no like Center for Autism and Related Disabilities of Virginia. Or
Connecticut or California.
correct. Yep, that's Florida made it up. So
Interesting.
that is Florida. Yep.
Some ideas for your state.
All those legislators. Yep.
All the legislators that have been on. Well, I thank you so much for coming today, presenting.
Thank you.
Any last questions? Any items anybody has? I see a hand up in the back.
I don't have a question, but I have a comment. As a grandparent, tourism is very, very serious in Florida. So you may come from other states, but the information on drowning prevention for children is very important, because if you're a grandparent and you have grandchildren and they come to your house, they're quick as lightning and they can disappear in no time. And you're absolutely correct. You don't check the garage, you don't check under the bed, you don't check anywhere. But if you have a pool in this rented location or wherever you live, your condo, you have to check the pool first. It takes seconds, and the child will jump in that pool because they're so excited to meet Grandpa who went to get his swimsuit on. Personally, this happened to me. We have an organization in Collier County called Safe and Healthy Children's Coalition. And yes, it's the #1 cause of death for children under 5 years old. If they can crawl, if they're a toddler, they are going to go to the water. You have to be very, very diligent about watching them at every moment. And that's why we have layers of protection, because you cannot make sure that you see them every single minute. But my granddaughter at 2 years old came to our home, and we never opened the sliding glass doors to the pool. But her grandpa went to get his swimsuit on, and I went to put hers on. And she slipped behind me, and she went straight to the living room where the door was opened by a crack. Grandpa came with his swimsuit and realized he forgot his towel. So he opened the door a little bit and went back to get his towel. In the meantime, she slipped away from me and went and jumped in the pool. She was so excited to meet Grandpa in the pool. At 2 years old, she went straight to the bottom. When he came out, he said, "Where is Zoe?" And I said, "We have to check the pool." I don't know why that happened, but education must have clicked in, because I heard about this. You have to check the pool first. He said, "She's not in the pool. It's like glass. There's no splashing, there's no screaming, there's no anything. She just slipped in the bottom." He jumped in and he got her, and he started to do CPR. I went and got the phone and called 911. They came, they picked her up, and they said, "How long was she under?" "Well, you can't even think straight." They took her to the hospital. She had aspirated. She had serious issues. They airlifted her to Fort Lauderdale. And I said, "You can't take her. Don't take her, please." They said, "We know what we're doing." The helicopter looked like a Tinker Toy helicopter. It was so tiny. But they said, "Just go sit down." They can do everything in that helicopter except open heart surgery. It's designed for children. She went to Fort Lauderdale and she survived. But many of the first responders came to me and said, "We never hear these stories where they're successful, because people do not respond instantly." And it was the instant response. Look in the pool. Nobody would have looked in the pool because it was so calm. There was no splash, there was no sound. Collier County is very serious about this because we have lots of tourism. And people come and they don't realize how serious it is for children to drown. There are ponds, there are canals, there are pools, everybody has water everywhere. And the children are excited by it, and the grandparents are not knowledgeable. We also have started the life preserver stations on all the beaches in Collier County. We provide Coast Guard approved life preservers that we put on the beach. You can take it, you can use it, and put it back. We lose a lot of them, but we're okay with that, because if they take them, they might use them. So we don't get upset about them taking them. But it is a very important thing in Florida. If you come from somewhere else, we love having you visit Florida. please be aware, this is the number one cause of prevented death of children. We can prevent this. Thank you.
Thank you for sharing that.
Thank you.
And I'll add, you said drowning is the number one cause of death in children under the age of 5, which is 100% correct. It is the number one cause of death in all children with autism, regardless of age. So even if you're like, oh, that kid's 7 or 8, still check the pool. You know, your message is perfect.
Thank you for sharing.
Is there a differential between children with autism unsupervised around water and supervised around water, and then looking at other pediatric water-related deaths, supervised, unsupervised?
It's a great question. Sorry, it's not right. So the vast majority of drowning deaths happen during non-pool time, especially children with autism. Most drowning deaths, which would be about 70 to 80% of drowning deaths, take place in a family's backyard swimming pool. But about 2/3, about 67% of drowning deaths in children with autism do not happen in the backyard swimming pool. They happen at a lake, body of water, neighbor swimming pool, somewhere that that child is eloped to. So, is there a differential? Sure, most kids drown when they're not supervised. Now that doesn't necessarily mean parents don't care or they're getting drunk in the backyard while the kids are swimming. No, it's a lot of times parents are sleeping at night like they're supposed to be, or cooking dinner, or we always kind of see here in Florida, I shouldn't say always, there seems to be an uptick around the holidays when kids are home from school, but parents are still working. So parents might be working from home, or there's a sitter who doesn't know to watch. So I don't know if that directly answers your question, but yes, unsupervised time is when children are drowning, for sure.
Is that it? Any more questions? Sure, I don't miss anybody. Well, thank you so very much. Truly appreciate it. Candy, thank you so much for inviting me to be your town ambassador. So happy today. And Chief Saunders, you're incredible saint. I want to thank you so much for everything you do.
I want to thank both of you. I think everybody can hear me, can't they? Kate, don't worry about it. I would like to thank both of you for taking your time and your expertise. And on behalf of Project Lifesaver and our attendees, I would like to present you with a certificate of appreciation. And I would like to add, Project Lifesaver in Florida works very closely with Carter, especially with Jack Scott. We have done a lot of collaborative things with him, and if any of the agencies want to communicate with us, I'm sure Jack Scott would love to talk to you. He likes to talk anyway, so he would love to talk with you and communicate some of the things. And I tell you, after moving from Virginia to Florida and finding CARD, they are an incredible organization. So I would advocate that other states look at this very closely. Now, you met David Silvers. Last year he came up on an impromptu and jumped up on the stage and helped us out. Well, following that, it was recommended that I consider him to be an ambassador. Now, for you may not be cognizant of our ambassadors, we got a bunch of them sitting around in here right now. So what do we require of an ambassador? Somebody that believes in our program, somebody that will help spread the word and help spread the program. So on behalf of Project Lifesaver International and Rick Duras, who is our chair of the Board of Trustees, today we are going to induct David Silvers as an ambassador of Project Lifesaver International.
Thank you so very much, Chief Saunders, and to the entire board. And I want to thank Candy again for introducing me to PLI. I call it PLI affectionately. I hope you're okay with that. there's a lot of acronyms and when you're in the legislature, a lot of state agencies, so just